MedHistory.
Polio, an acute, highly contagious viral infectious disease caused by damage to the gray matter of the spinal cord by poliovirus and characterized mainly by pathology of the nervous system. It mainly proceeds in an asymptomatic or erased form. Sometimes it happens that the poliovirus penetrates the central nervous system, multiplies in motor neurons, which leads to their death, irreversible paresis or paralysis of the muscles innervated by them. Polio, Heine-Medina disease, infantile spinal paralysis, is an enterovirus infection caused by polioviruses, affecting the motor neurons of the anterior horns of the spinal cord, which leads to severe paralytic complications with disability of the patient. The greatest susceptibility to polio, 60 to 80%, is observed in children under the age of 4 years. Therefore, the disease is studied mainly in pediatrics, pediatric neurology, and pediatric orthopedics. The last polio epidemic in Europe and North America was recorded in the middle of the last century. In 1988, WHO adopted a resolution proclaiming the task of eliminating polio in the world. Currently, in the countries where preventive vaccination against polio is carried out, the disease occurs in the form of isolated sporadic cases. Afghanistan, Nigeria, Pakistan, Syria, and India are still endemic for polio. The countries of Western Europe, North America, and Russia are considered polio-free territories. The causes of polio. The infection is caused by 3 antigenic types of poliovirus, I, II, and III, belonging to the genus of enteroviruses, the picornavirus family. The greatest danger is the type I poliovirus, which causes 85% of all cases of the paralytic form of the disease. Being stable in the external environment, the poliovirus can persist in water for up to 100 days and in feces for up to 6 months. It tolerates drying and freezing well. It is not inactivated under the influence of digestive juices and antibiotics. The death of poliovirus occurs when heated and boiled, ultraviolet irradiation, and treated with disinfectants, bleach, chloramine, formalin. The source of infection in polio can be both a sick person and an asymptomatic virus carrier that secretes the virus with nasopharyngeal mucus and feces. Transmission of the disease can be carried out by contact, airborne droplets, and fecal-oral routes. The susceptibility to poliovirus in the population is 0.21%. The absolute majority of cases are children under 7 years of age. Seasonal peaks of morbidity occur in the summer and autumn period. Vaccine-associated polio develops in children with severe congenital or acquired immunodeficiency, more often HIV infection, who received a live oral attenuated vaccine. The conditions contributing to the spread of the poliovirus are insufficient hygienic skills in children, poor sanitary and hygienic conditions, crowding of the population, and the lack of mass-specific prevention. The entrance gate for the poliovirus in the body of the new host is the lymphoepithelial tissue of the mouth and nasopharynx, intestines, where the primary replication of the pathogen occurs and from where it enters the blood. In most cases, primary viremia lasts 5-7 days and ends with recovery when the immune system is activated. Only 1–5% of those infected develop secondary viremia with selective damage to the motor neurons of the anterior horns of the spinal cord and brainstem. The penetration of the poliovirus into the nervous tissue occurs not only through the blood-brain barrier, but also through the paraneural route. By penetrating into cells, the poliovirus causes a violation of the synthesis of nucleic acids and protein, leading to dystrophic and destructive changes up to the complete death of a neuron. The destruction of nerve cells leads to the development of paresis and complete paralysis, followed by muscle atrophy and contractures. The source of infection is only human. Moreover, for one case of a disease with a pronounced clinical picture, there are from 100 to 1,000 cases of carrier, release of poliovirus without complaints. Due to its high natural susceptibility to the virus, the carrier is a threat to others. How polio is transmitted. The mechanism of transmission of infection is fecal-oral. It is realized through water, food, and household transmission routes, that is through contaminated hands, food, and water. Sometimes the virus is transmitted by airborne droplets and airborne dust roots. A person becomes contagious even before the onset of symptoms. In the nasopharyngeal compartment, the virus appears 36 hours after infection, in the feces, 3 days later. Most of the viral particles are released in the first week of the disease. From the nasopharynx, the virus enters the environment within 7 days from the intestine, up to 42 days. Polio can be suspected with a characteristic clinical picture: the presence of paresis and paralysis, an acute onset of the disease with fever, and a special epidemiological history, contact with a polio patient in rare cases, with a vaccinated live vaccine within 60 days, lack of vaccinations in the patient, travel to countries with reported cases of polio. Evaluation of the vaccination history is an important step in making a diagnosis. The doctor should clarify whether the patient was vaccinated, how timely and fully he did it, whether the vaccine was live or inactivated. Laboratory diagnostics is performed to confirm the diagnosis. Treatment of polio. Antiviral therapy has not yet been developed, so treatment is aimed at eliminating symptoms and preventing the development of complications. During the paralytic and paralytic periods, physical activity is excluded. The patient must observe bed rest. To strengthen the immune system, drugs based on interferon alpha, normal human immunoglobulin, and ribonucleus are prescribed. Painkillers are used for pain relief. In case of damage to the intercostal muscles and diaphragm, when the patient cannot breathe on his own, he is transferred to artificial ventilation. In case of swallowing disorders, nutrition is organized through a probe. How not to get polio? In order not to spread the disease, a polio patient should be isolated for at least 40 days. People who have been in contact with the patient are being monitored for 21 days. Children who have been vaccinated according to the violated scheme, and all unvaccinated, regardless of age, are subject to immunization. In extremely rare cases, completely unvaccinated people and people with immunodeficiency can become infected from those who have recently been vaccinated with a live polio vaccine. Therefore, such people are either separated, close contacts are limited for a maximum of 60 days, or vaccinated with an inactivated vaccine. But if a child has been vaccinated with an inactivated vaccine before and has no pathology of the immune system, there is no risk of getting sick. Polio is a disease that can be completely eliminated, primarily through vaccination. It will allow hundreds of thousands of children to avoid paralysis, disability, and death. Therefore, it is very important not to give up vaccinations against polio. Remember that the risk of contracting polio and remaining disabled for life is thousands of times higher than the risk of side effects from the use of the vaccine. As soon as the cases of the disease completely disappear, it will be possible to switch exclusively to the use of an inactivated vaccine.